In this presentation, I will be analyzing a study called the inhaled nitric oxide for the adult respiratory distress syndrome. First, I will start off by discussing what nitric oxide is as a whole. Nitric oxide is a colorless gas with a chemical formula of NO, being one nitrogen molecule and one oxygen molecule. It has many benefits for the human body as it is known to be integral in many cellular activities, including assisting the immune system to fight off bacteria, regulating the blood pressure by dilating the arteries, and helping transmit information between nerve cells and the brain. I will move on to discussing what the adult respiratory distress syndrome is. Adult respiratory distress syndrome, also known as ARDS, is a syndrome of chronic respiratory failure. This is a rapidly debilitating disease brought on by fluid leaking into the lungs, which makes breathing nearly impossible. The disease usually starts out with an initial injury and is diagnosed as ARDS once other conditions are ruled out. As you can see, here's a chest x-ray of a patient with ARDS compared to a normal patient. This shows the clogging of the arteries in the patient with ARDS, which makes it difficult for them to breathe. Now I will discuss nitric oxide and how it is beneficial to the lungs. As previously stated, nitric oxide is important for many functions at the cellular level of the body. However, many medical advances have shown that nitric oxide is a therapeutic tool for the lungs. Nitric oxide is known to effectively regulate the vascular and airway tones inside of the lung. It is also shown to be a vasodilator, meaning it is able to improve oxygenation in the lungs. The overall purpose of this experiment is to improve the lung function of several adults afflicted with adult respiratory distress syndrome. Due to the known beneficial effects of nitric oxide, this experiment seeks to treat this syndrome by giving doses of inhaled nitric oxide to several patients over a certain time period, from 3 to 53 days. The researchers in this experiment hypothesized that the inhalation of nitric oxide would improve the lung function of patients with adult respiratory distress syndrome, specifically by reducing the narrowing or blockage of pulmonary arterioles and thereby improving the gas exchange within the lungs. This experiment was conducted by selecting 10 patients with a history of previous lung disease and severe ARDS. Their clinical characteristics were reported upon admission, before any nitrate oxide treatments were administered. The inhalation process began 3 days after admission before signs of recovery. During the 3 days, all patients had undergone ventilation, and 6 were treated with velovenous extracorporeal membrane oxygenation. All patients were sedated and relaxed before treatment. 9 out of 10 patients with adult respiratory distress syndrome inhaled 2 different concentrations of nitric oxide for 40 minutes each consecutively. Many different variables needed to be controlled, so they were measured by using multiple inert gas elimination techniques to be later compared and to ensure these variables did not affect the results. These variables are gas exchange, ventilation perfusion distributions, and the hemodynamic variables. The results yielded by this experiment were that the inhalation of nitric oxide reduced the average pulmonary artery pressure from 37 mm mercury to 30 mm mercury, and also decreased pulmonary shunting by 5% in both long and short-term exposures. Additionally, the average arterial pressure and cardiac output of the heart, which is the amount of blood pumped, did not change. This is a line graph that shows the pulmonary artery pressure in millimeters mercury of the patients before, during, and after treatment. From before treatment to during treatment, the pulmonary artery pressure did decrease significantly, but once treatment had stopped, the pulmonary artery pressure then went up again, but not all the way back to what it was before. Overall, this experiment was considered successful. The researchers had initially hypothesized that the inhalation of nitric oxide by patients with severe ARDS would result in improved lung function, and the results of this experiment did support the hypothesis. The experiment resulted in a drop in pulmonary artery pressure, which means that artery had dilated significantly enough to relieve the pressure caused by the condition. This also means the gas exchange increased, thereby meaning the amount of oxygen received by the patients had also increased. They were able to breathe more easily and with less pain. However, this treatment cannot be considered a cure for the condition of ARDS because the average arterial pressure had not changed, which is a factor that is extremely essential in the gas exchange process. Thus, breathing is still difficult compared to healthy patients. Additionally, the pulmonary artery pressure did drop during treatment. However, once treatment had ended, the pulmonary artery pressure did once again rise. Therefore, this treatment is a short-term treatment overall.